Dear all, I welcome you all to this special, presentation from Sarthi Super Specialty Orthopedic Center, Bangalore. Our team now consists of, myself, Dr. Shrikant KN, Dr. Jeff Kosh, who's just returned from Dundee, UK, and Dr. Karthik Sangani, who has done his MS from prestigious Osmania Institute of Medical Sciences in Hyderabad. As we all know, knee and hip arthritis is a big problem in India. Around 200 million patients, that is 200 lakh patients, are suffering from this dreaded disease, causing disability and dependence of these elderly patients on their younger families and suffering unnecessary pain. And the treatment for, end-stage hip arthritis is hip replacement surgery, and for end-stage knee arthritis is a knee replacement surgery. And both these surgeries, were developed in England, and since 1964 they have been successfully performed. And those are both the surgeries are the most quality of life improving procedure and the most cost-effective procedure in the whole world. And the same results are now being replicated in developing world like India as well. What we noticed, in the Indian practice is that the patients have a morbid fear of pain post surgery or sometimes during surgery. And these are a couple of memes, but the anesthesia has developed, way back from 18th century, where they didn't have any other method to numb the limb or numb the person except using alcohol or opium, or sometimes even a big hammer as shown in the picture to knock the patient off so that they can operate and correct the deformities or fix a fracture. But now in 2022 this is no longer the way we are doing it. In 2022 what we are doing is we are using oral painkillers or oral opiates, like tramadol, which a lot of you know by the commercial name that is commonly used here. Or if the oral painkillers don't work, then we use injectable painkillers. And during surgery, we use something called as epidural anesthesia. And in the epidural anesthesia, we basically numb the legs by injecting the spine. And this is a very, very useful thing because we can even leave a pump in the back, and we can give continue patient pain relief for 3 to 4 days following surgery. Local infiltration within the joint is a very well-established procedure now in arthroplasty, particularly in hip and knee. Nerve blocks are a boon to the patients, and we do both femoral nerve block, sciatic nerve block, and newly the adductor nerve block, which only blocks the sensations to the knee but doesn't block the motor supply. That means the patient can walk for physiotherapy post knee replacement, but he will have no pain absolutely whatsoever. And most of our patients do experience complete pain loss following surgery. So there is absolutely no need to be afraid of surgery. We also use cryotherapy, which is basically ice therapy, to take the pain away. And sometimes when nothing works, we can use transdermal patches, that is pain relief going through patches like this. Now, coming to some of the patient
Hi, this
experience,
is Hemant.
let's
I
listen
work
to
for a
Hemant.
software company, and basically, I had an accident around 9 years back, wherein a tree fell on my shoulder, and as a consequence of me being pushed down, I had a fracture of the hip joint, and I had screws implanted, which started slowly giving away in the last few years, and even the hip joint had collapsed. And thanks to Dr. Shrikant, a few months back, I had a very successful hip, total hip replacement surgery. And today I'm walking naturally. I'm a completely, totally changed human. Very confident. I can drive the car across, for many kilometers now. I can walk anywhere, however long I want. So I can feel the difference in my life today. I'm totally independent. No pains anywhere. So that is the outcome of this operation. It was very successful, and I'm thankful to the doctor.
So for Hemant, I had to get a customized implant from America, and he had first of its kind implant that we used in India, and he had an unbelievable result because 8 weeks following his surgery, he could go to Mysore Dasara with his family and drive all the way from Bangalore to Mysore. Sometimes when you come back in the weekend, how long it takes to come from Mysore to Bangalore. And he really drove 6 hours continuously with his children and wife to Dasara. And he was extremely pleased because he never thought he would do that ever in his life. This is patient number 2.
ಬಂದು 47 ವಯಸ್ಸಲ್ಲೇ ಈ ಪ್ರಾಬ್ಲಮ್ ಇತ್ತು. ಅಂದ್ರೆ 10 years ಕೆಳಗು ಮಾಡಿಕೆಮಾನ ಹಂಗೆ ಅಂತ ಹೇಳ್ತು ದುಬ್ಬಿ ಹಾಕ್ಸಾಡ್ದೆ. ಸರ್ಜರಿ ಮುಂದೆ ನಂಗೆ ತುಂಬಾ ನೋವಿತ್ತು, ನಡಿಗಕ್ಕಾಗಲ್ಲ, ಮಲಿಕ್ಕಿಂಬದು ಕೂಡ ತುಂಬಾ ಶ್ರಮವಾಯ್ತು. ನೀ ಪ್ರಾಬ್ಲಮ್. ಸೊ ಡಾಕ್ಟರ್ನ ಅಪ್ರೋಚ್ ಮಾಡಿದೆವು. ಅವ್ರು ಹೇಳಿದ್ರು ಈ ತರ ಮಾಡಿಕಿದ್ರೆ ನಿಮಗೆ ಬೇಗ ವಾಸಿ ಆಗುತ್ತೆ, ನಾರ್ಮಲ್ ಲೈಫ್ ಸಿಗತ್ತೆ. ಸರ್ಜರಿ ಮುಂದೆ ತುಂಬಾ ಅಜ್ಜಿಗೆ ಇತ್ತು, ಇದ್ರೂ ಬೇರೆ ದಾರಿ ಎಲ್ಲ ಮಾಡಿಕಿರ್ತಾ ಆಗ್ಬೇಕು ಅಂತ ಹೇಳ್ತು. ಎಲ್ಲ ಒಳತನವ ನಡೀತು. ಇವಾಗ ನಾನು ಚೆನ್ನಾಗಿ ನಡೀತೇನೆ, ಕಾಲ್ ಬಳಸ್ಲಕ್ಕಾಗ್ತ, ನೋವಿಲ್ಲ. ನಾನು ಸ್ಟೆಪ್ಸ್ ಹತ್ತುತ್ತೇನೆ, 3 floor ನಾನು ಹತ್ತುತ್ತೇನೆ. ಸೋಫಾ ಕೂಡ ಲೋ ಟೈಪ್ ತರ ಸೋಫಾ ಕೂಡ ಇವಾಗ ನಾನು ಕೂತ್ಬಿಟ್ಟು ಎದ್ದು ಮಾಡ್ತೇನೆ.
3 months ಆಯ್ತು.
3 months ಆಗುತ್ತೆ ನನ್ನ ಸರ್ಜರಿ. ಇವಾಗ ನಾವು ಬೆಟರ್ ಫೀಲ್ ಮಾಡ್ತೇನೆ.
ಕೆಲಸ ಎಲ್ಲ ಮಾಡ್ಕೊಳಕ್ಕಾಗ್ತದೆ.
ಯಾರು ನನ್ನ ಫ್ರೆಂಡ್ಸ್ ಕೂಡ ಒಬ್ರು 2 ಮಾಡಿಕಬೇಕು ಅಂದ್ರು. ನಾ ಹೇಳಿದೆ ಮೊದಲೇ ಹಿಂಗೆಲ್ಲ ಇರೋದು, ಅಂದ್ರೆ ನೆಕ್ಸ್ಟ್ ಇದನ್ನ ಫೇಸ್ ಮಾಡಿದ್ರೆ ಹಿಂಗೆಲ್ಲ ಆಗೋದು. ನನ್ನ ಫ್ರೆಂಡ್ಸ್ ಎಲ್ಲ ಸಜೆಸ್ಟ್ ಮಾಡಿದ್ರು, ಸಜೆಸ್ಟ್ ಮಾಡಿದ್ರು. ಫ್ರೆಂಡಿಗೆ ಅವಳಿಗೆ ಇದೇ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ನನ್ನ ಫ್ರೆಂಡಿಗೆ ಚೆನ್ನೈಲಿ ಇದ್ದಾರೆ. ಹೇಳಿದ ಮಾಡಿಕೋ, ಸರಿ ಆಗುತ್ತೆ.
So you really this very important. Novilla 3 months down the line, novilla ಮತ್ತೆ 3 flights of stairs ಹತ್ತತೀನಿ ಅಂತ ಹೇಳಿದ್ರು. ಮತ್ತೆ ಸರ್ಜರಿಕಿನ ಮುಂಚೆ ತುಂಬಾ ನೋವಿತ್ತು, and she was in lot of pain, and she could sleep in the night. So very, very typical night cries, typical feature of advanced arthritis that she is talking about. So now completely disappeared in 3 months, and she is able to do her own activities. Let's go to patient number 3 who had a completely fused knee because of advanced rheumatoid arthritis.
ಕುಮಾರಿ ಅಂತ, ನನಗೆ 10 years ಇಂದ ಆರ್ಥ್ರೈಟಿಸ್ ಇದೆ. ಈಗ ಏನು ಅಂದ್ರೆ ನಂಗೆ 2 ಜಾಯಿಂಟ್, ನೀ ಜಾಯಿಂಟ್ ಸಿಕ್ಕಾಪಟ್ಟೆ ಪೇನ್ ಆಗ್ಬಿಟ್ಟು ನಾನು ಡಾಕ್ಟರ್ ಶ್ರೀಕಾಂತ್ ಅವ್ರ ಹತ್ರ ಬಂದು ತೋರಿಸಿದಾಗ ಅವ್ರ ಹತ್ರ ಈ ಲೆಫ್ಟ್ ಲೆಗ್ ಫುಲ್ ಫ್ಯೂಸ್ ಆಗಿದೆ, ಮತ್ತೆ ಆಪರೇಷನ್ ಬೇಕೇ ಬೇಕು ಅಂತ. ಸೊ ನಾನು ಒಪ್ಕೊಂಡು ಮಾಡಿಸ್ಕೊಂಡೆ. ನಂಗೆ ಮಾಡಿಸ್ಕೊಳಕ್ ಮುಂಚೆ ಇದ್ದಿದ್ ತೊಂದ್ರೆ ಏನು ಅಂದ್ರೆ, ಚೇರಿಂದ ಹೇಳ್ಬೇಕಾದ್ರೆ ಇಷ್ಟು ಪೇನ್ ಆಗ್ತಿತ್ತು, ಅಲ್ಲಿ ಇಲ್ಲಿ ಹೇಳ್ಕೊಂಡು ಹೇಳೋದು, ಎಲ್ಲದಕ್ಕೂ ಸಪೋರ್ಟ್ ಬೇಕಿತ್ತು. ಹೇಳುವಾಗ ಕೊಡುವಾಗ ಇಷ್ಟು ಪೇನ್ ಆಗ್ತಿತ್ತು, ತಡ್ಕೊಳಕ್ಕೆ ಆಗ್ತಿಲ್ಲ. ಮತ್ತೆ ಟಾಯ್ಲೆಟ್ ಅಲ್ಲಿ ಕೂಡ ಅಷ್ಟೇನೆ, ಅಲ್ಲೂ ತುಂಬಾ ಪ್ರಾಬ್ಲಮ್ ಇತ್ತು. ಬಟ್ ಈಗ ಆಪರೇಷನ್ ಆದ್ಮೇಲೆ ಕ್ಲೀನ್ ಆಗಿ ಹೇಳ್ತೀನಿ, ಕೊಡ್ತೀನಿ, ಅದು ಅಲ್ಲಿ ಪೇನ್ ಇಲ್ಲ ಲೆಫ್ಟ್ ಅಲ್ಲಿ. ಸೊ ನಂಗೀಗ ಆರಾಮ್ ಅನ್ಸ್ತಾ ಇದೆ, ಪರವಾಗಿಲ್ಲ. ಮತ್ತೆ ನಾನೇ ನನ್ನ ಪಾಡಿಗೆ ನಾ ಇಂಡಿಪೆಂಡೆಂಟ್ ಆಗಿ ನಡೀತೀನಿ, ಮತ್ತೆ ಸ್ಟೇರ್ ಕೇಸು ಹತ್ತೀನಿ. ಪೇನ್ ಏನಿಲ್ಲ ಈಗ, ಅಷ್ಟು ಪರವಾಗಿಲ್ಲ. 3.5 ತಿಂಗಳಾಯ್ತು. ಸೊ ಎಕ್ಸಸೈಸ್ ಎಲ್ಲ ಮಾಡ್ಕೊಂಡು ಅವ್ರು ಹೇಳ್ದಂಗೆ ಥೆರಪಿಗಳದೆಲ್ಲ ಮಾಡ್ಕೊಂಡಿದೀನಿ. ಪರವಾಗಿಲ್ಲ, ಆರಾಮಾಗಿದೆ ಈಗ ಸುಮಾರಾಗಿ.
ಸೊ ಪೇನ್ ಇತ್ತು ಆಪರೇಷನ್ಗಿಂತ ಮುಂಚೆ, ಈಗ ಪೇನ್ ಇಲ್ಲ, ಮತ್ತೆ ಮೆಟ್ಲೆಲ್ಲ ಹತ್ತುತ್ತೀನಿ ಪೇನ್ ಇಲ್ಲದೆ. ಸೊ ದಿಸ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಶಿ ಹ್ಯಾಡ್ ಸಿವಿಯರ್ ಪೇನ್ ಬಿಫೋರ್ ಸರ್ಜರಿ. Now 3 months down the line, she has no pain. She is able to climb stairs. This is a recurrent example of patients. I've done more than 15,000 surgeries in the UK and several complex surgeries also. And this is typically what every patient says after knee surgery or hip surgery. It's very typical. And I hardly have heard anything different compared to what these patients have said, both in UK and in India. So, coming to the key things, as doctors, we do empathize, with our patients. When patient says, "Will get pain, doctor," we do empathize. It's not just a sympathy, but we do feel that yes, we do understand that they are concerned about pain. Okay, and we understand their concerns. We appreciate it. But it's very essential to understand that as a profession, we have moved a long way from 18th century, where we had Matilda with a big hammer knocking people's head off to control pain, to the 21st century practice, or what we are doing now, the modern anesthesia. And as you have heard from the 3 post-surgery patients here, you don't have to be afraid of pain either during surgery or after surgery, in the 21st century. Okay. And moreover, at our unit, Sarthi Super Specialty Orthopedic Center, we use advanced technology like robotics. And what I've experienced in the last 1 year with robotics is that it is causing much further reduced pain and much less bleeding during surgery. And I've almost stopped giving blood transfusion in the last 1 year for these patients. And this has surprised me also. Okay. And all my robotic patients are going home 1 day before my other patients. So this is consistently I'm seeing. I'm about to write a paper on this, but it is something, a lesson that I've learned myself. So at SSOC, you can definitely experience Europe in India, because the team is trained in Europe, and we're trained by both the British Knee Surgery Society president and the European Hip Society European Hip Society president. So you're getting the top of the line treatment here, right? Sitting in Bangalore or Karnataka or India. You don't have to go to foreign countries to experience it anymore. So please don't be scared about surgery or about post-operative pain. So this is the message I want to give to all my patients. Be bold. COVID numbers have decreased now. The people dying in Bangalore are close to zero. This is the time to get rid of your knee pain. Okay. So there's no point blindly swallowing painkillers which cause the damage to kidneys. We know the kidney transplant ranges from 10 lakhs to 15 lakhs in top corporate hospitals. And if the kidney causes hepatorenal syndrome, causes liver failure, you're looking at additional 35 lakhs to 40 lakhs expenditure. So let us not be penny wise and pound foolish and put up with pain and keep on postponing surgery. So let us go for it and be pain relieved. And also let us be of helpful to society and to our own children, and let's not become a burden on them. So I end my presentation here. Thank you very much for patient listening. Bye-bye.